Good evening, everyone, and welcome to our live stream tonight. We're going to have a virtual question and answer live stream regarding COVID-19 vaccines and boosters. And this is presented by the New Jersey Department of Health. We'll also be talking about influenza vaccine and ways to keep yourself healthy during this holiday season. We're delighted that you're able to join us. And I want to start by introducing myself. I'm Meg Fisher. I'm the acting Deputy Commissioner of Health in New Jersey. And I'm here tonight with two excellent colleagues from the New Jersey Advocates for Aging Well. And I'm going to ask them to introduce themselves as well. Dr. Raymond.
Hi, nice to talk to everybody tonight. Josh Raymond, a physician who works for Rutgers Robert Wood Johnson Medical School, and I work at a federally qualified health center in Freehold, New Jersey. Also a medical director at nursing homes and supervise employees at the nursing homes, as well as take care of patients in that setting. I am also a geriatric fellowship director, and Dr. Upadhyaya is our current geriatric fellow.
Hi, everyone. Nice to meet you guys. I'm Dr. Upadhyaya. I am a family medicine physician and also a geriatric fellow, like Dr. Raymond said, at Central State Medical Center in Freehold. Nice to meet you all, and hopefully we can answer all the questions you guys have about COVID vaccines.
Thank you so much. And before we get started, can the two of you tell us a little bit about what you're advising your patients on ways to keep themselves healthy and safe during these holidays and into the new year?
Sure. Dr. Fisher, right now, as we all start getting indoors, we're going to be around a lot of people. And I think going back to the basics from all the way back in 2020, wearing masks, making sure that if we do meet with people, it's a well-ventilated room, or maybe even meeting outside still if there's going to be a large group of people getting together. Great idea, maybe even testing yourself before you do go for some of these activities and making sure that you're testing negative for COVID. And certainly if you have any symptoms, any upper respiratory symptoms like a cough or sniffles, fevers, that you stay home. No reason in even risking that. And really taking care of yourself.
Thanks for that. And Dr. Upadhyaya, go ahead.
Yeah, so I agree with Dr. Raymond. Definitely stay home if you're sick and take a test. You could do rapid test, PCR. You don't want to expose anybody else if you have COVID or the flu, especially with these gatherings. You may be meeting elderly people and you don't want to get them sick. Also wear a mask, especially if you're going out grocery shopping or anywhere where there's large amount of people, as well as continue to wash your hands, sanitize your hands.
Fantastic. I think it is interesting. We are going back to masks now because not only do we have COVID-19 out there, we have two other viruses that can cause serious infections. And that includes influenza, which is rampant in New Jersey now, in all areas of New Jersey, and the respiratory syncytial virus, a virus we used to talk about only in children, but we now realize that this virus can really cause havoc for our older adults. So, and especially for people whose immune systems are compromised. So the mask works. It doesn't care whether it's COVID-19 or influenza or RSV. And we really want to remind people to wear the masks, wear it properly. And, we need it mostly for indoors. But what I've found is when you have it on properly, it's also keeps you warm when you're out of doors. So go ahead and keep yourself protected as much as you can. Let's go ahead now to the first question. This is a question from Kathy, who's 82 years old. She's in Ocean County, and she received her COVID booster shot, her first one, in April of 2022. And then in September, when the bivalent boosters became available, she got the bivalent Moderna booster as well. And she had a little bit of fever after it, but she recovered nicely. What she wants to know is, this week, there's a neighborhood pop-up, and they're featuring the COVID-19 booster shot. Does she need to get it again?
It sounds like she's fully vaccinated, that she's received. I assume that the one in September, if I'm not mistaken, was the bivalent. So she's fully boosted at this point.
I agree with you 100%. She's fully vaccinated. We talk about as just having the primary series, but she's actually up to date. So she's had the most recent booster that's recommended for her. And at this time, just a single bivalent booster is what's recommended. Now, here's another question from Pamela. She wants to know, she's been immunized 4 times, and she's now thinking about getting the Novavax vaccine because it's not a messenger RNA vaccine. But the updated Pfizer and Moderna vaccines are geared more toward the latest variant. So what's the recommended choice in her situation?
You know, it's my understanding right now, the only recommended boosters are either the Pfizer or the Moderna, because those are both targeted towards the Omicron variant. And that's what we're trying to protect against.
Correct. Yeah, absolutely. And the Novavax vaccine is recommended for people who can't get the messenger RNA vaccine. So there would be, she's fully vaccinated. There's no reason, again, for her to get another vaccine. I agree with you 100%.
Can I ask a question? What would be a contraindication for us against the Novavax, that you wouldn't be able to get the Pfizer or the other mRNA, Moderna?
So mainly that would be if you've had an allergic reaction.
Okay.
So that, you know, if you've had anaphylaxis or a serious reaction to the messenger RNA vaccine, then the Novavax is available. And then there are some people who just would prefer to have a vaccine that has a more of the protein, the usual way that we make vaccines. And in that scenario, if they don't want to get the messenger RNA, the Novavax vaccine is available. But just as you mentioned, unfortunately, it's not available as a booster. It's just available as the primary series. So just 2 shots, no booster. But then you can, following the Novavax, you can get a Pfizer or Moderna booster. Okay, here's another one for you from Lauren. Lauren asks, she says she'll be receiving her last shot in the rabies vaccine series on December 23rd. And she was due for her COVID booster when she got attacked by these unvaccinated dogs. So she wants to know, how long after the rabies shot does she have to wait before she can get her COVID booster?
Well, that's a great question. I don't think there's any evidence-based medicine for that. I know that initially they were recommending waiting 2 weeks between immunizations, but that went away, right? That you were able to receive vaccination simultaneously. So with the rabies as well as the influenza, that if you wanted to get both of those shots on the same day, you could do that and save yourself a trip to the doctor's office.
Yep. And if you haven't gotten that booster, I would recommend you not wait. Go ahead and get it at the same time as you get the rabies shot, or the next day or the next week or the day before. There's no time interval anymore between COVID-19 vaccines and other vaccines. So it's just as Dr. Raymond recommended. And, you know, we know that the incidence, the COVID numbers are creeping up across New Jersey. We're seeing more hospitalizations, and we know that people who are older are at higher risk to get in trouble with COVID-19. So don't wait on that booster. Go ahead and get that. That brings us to a question for you. How long is the COVID-19 booster expected to last? And I'm thinking that means, how long does your protection from the vaccine last? It's almost,
you know, I would, I think that's out in the open. I would imagine at least for 1 year once it's up to date. But I think you have to follow other variants that might be coming, and if the immunizations that are coming out have different components that would protect you, I think you'd have to update it with that. So, and any other insight on that, Dr. Fisher?
Yeah, I'm with you. I think that's a little bit looking into your crystal ball. We actually don't know the answer, but one of the reasons we don't know the answer is first of all because we haven't been using the booster that long, but also because we don't know how well it will hold up against the variants that are evolving. The good news is we know that it's very active against the variants that we currently have in New Jersey, the BQ1 and the BQ1.1, as well as the BA5. So that's the good news, but who knows, what letter is going to turn up next. There's new variants coming up, almost weekly. And we need to wait and see what else is going to evolve and whether or not the current booster will remain active, or whether it'll be time to develop a new booster.
Dr. Fisher, remember Delta?
Yeah, I sure do. I remember Alpha.
Oh, so just to kind of refresh us, and it just, you forget about those, and how damaging they were, right? That's such a short-term memory with it.
Yes. Yep. And now we've had Omicron really for the last year. But and that's pretty long for one variant. So
Sure.
we certainly may come up with a new variant soon. Let's go to the next question. How accurate are the antibody blood tests for COVID-19? Does vaccine effectiveness show in the blood tests, and how long after will it be reflective? So should people be getting antibody titers to see if they're protected? What do you think?
I don't think so. And there's really nobody saying that you should do that to see what your titer is and seeing whether or not you're protected against it. There are two different tests, one that looks for the antibodies to the protein from the vaccine, and then one that looks for antibodies to the natural actual virus. But people are not recommending that as a way to gauge whether or not you could go out into a public space and feel confident that you're not going to get COVID from that.
Yep, I'm with you. So save your blood. Don't get an antibody test. Keep your blood with yourself, and just pay attention to what the recommendations are, as far as going forward. Now I see we have a question from Sally. Sally had COVID in the middle of September. When can she get her booster?
Sally, how old are you? If I can ask, I should be careful with that.
She can't get back to us directly, but let's say she's 72.
Some people, they had recommended, waiting 3 months at one point. And I think other recommendations are waiting until you're asymptomatic. So I think either one of those is what I've heard.
Yep.
I think more so. Oh, sorry.
No, go ahead.
Was it 3 months when we were also giving the monoclonal antibodies? They had to wait the full 90 days before receiving the booster and vaccine. But I think now, I think like Dr. Raymond said, it may be until you're asymptomatic.
And making sure that you just get that on board as quickly as possible.
Yeah, so you're absolutely right. The recommendations have changed, which makes people wonder, do we know what we're talking about? But the information has changed, and the disease has changed. So when we first started with vaccine, we did tell people they could wait because we didn't have enough vaccine. So that was actually the original reason that we waited the 3 months, just so that people who hadn't had a chance to get vaccine could get it because we didn't have enough vaccine. Now that we have plenty of vaccine, we're not so worried about that. Then there was a question whether the monoclonal antibodies would interfere with your take. So that was recommended for a while, and then that went away. But just recently, again, the Center for Disease Control and Prevention has said you could wait for 3 months after you've had the disease. Now, what I think is even more important than how old you are, and Sally did get back to us, and she says that she's 87. So it's not only how old you are, but also what other underlying problems do you have?
Right.
So if you have a lot of comorbidities, what I would suggest is not waiting the whole 3 months. Wait until you feel better, maybe closer to a month and a half, to really try to get you protected. Because again, we don't know what the next variant will bring. And a healthy 87-year-old, we want to keep you healthy. So, that would also go into your thinking as far as whether you need to wait or not.
And also, even when you do get it, it takes 14 days until you really develop those antibodies. So you have a little bit of a delay there. So as we go into the holiday seasons where we'll be seeing families, right, to be protected, it'll be important.
I think that's very important for people who are traveling. It's a good idea to get yourself protected before you go somewhere else. And be ready. So especially now that a lot of people aren't necessarily wearing masks or being as careful as they once were.
I was at a mall, if I can just interject, and I'd say about 1 in 10 people had a mask on. And I was at an airport, and maybe a little bit better there, maybe 3 out of 10. So really, when you do travel, wear a mask.
I would agree with you, particularly if you're compromised at all. If you're older, if you're as old as I am, definitely, wear the mask, protect yourself. Melissa has a question. Are there studies that have had these vaccines given at the same time, like flu and COVID, or maybe rabies? Now, I don't think there's much information about giving rabies at the same time, but they're definitely they have looked at flu and COVID at the same time, and there are studies, and they don't interfere with the uptake one with the other, and they don't increase the side effects. And what I always say is, your arm's going to hurt when you get a vaccine. Well, why not get all the pain at once so that you don't have to have it twice? So there's no reason not to get them at the same time. But
I'll give children immunizations, and some of the vaccines have up to 4 different protections in there. So it really is not that novel. We've been doing this for 20, 30, probably 40 years now.
Yep.
So it is well tried.
Yep. Absolutely. All right, let's go to another question. What are the differences between the COVID-19 boosters that were available in 2021 and the boosters that are being administered right now?
Sure. There's 2 different variants in there now. There's the natural, the first COVID that came around, and then we have the Omicron that you're protected against. And most of the infections now are from the Omicron variant. So you're protected against both of those. And the original only was against the first, the natural occurring COVID virus.
So if I'm going to get a booster, and I get to the drugstore, do I have to tell them which booster I want? Do I have to tell them that I want the bivalent booster, or what's the deal?
They're probably they're going to give that to you, but confirm that they have old stock. I would highly doubt that. But just anything that you're doing with your body, ask a question about and be invested in that. But you should be pretty confident they're going to give you the right one.
Absolutely. And that's good advice. It never hurts to ask.
Yeah.
If you don't understand the first time, ask it again until they explain it to you in a way that you understand.
That's great advice.
Absolutely. And then here's another question. Should I be aware of risks related to the boosters? And if so, what are they? Dr. Padre.
So as risk with any vaccines after getting the booster, you may feel some pain in the arm, you may get some chills, fever, you may feel tired, which could last about a day or 2. There could also be a rare chance that you may develop an allergic reaction to the booster, but it's not really seen as much, but it is possible. But if you've had the other vaccines and haven't had any reaction, then it's unlikely that you may develop a reaction.
Our federally qualified health center, I think, is responsible for delivering 50,000 of these, and I'm not aware of an anaphylactic reaction, to be honest. But certainly be cautious about that your body might be allergic to something in the compound or in the solution. And I bet you if you go around to your friends and peers and you ask them about, how did you feel afterwards? I'll tell you, last year's flu shot, I felt a little gripey, but the last booster I got and my flu shot this year, and it was, I felt fine the next day. So I think these are very well tolerated. A sore arm, right? But that's what anything you get a hit on the arm, you're going to have some pain there.
And I think we now realize that those reactions are actually evidence that your immune system is working.
Mm-hmm.
So rather than think of them as adverse events, kind of welcome them as evidence that, oh, I'm getting ready to fight off this virus. whether it be the flu shot or the COVID-19, or
Mhm.
anyone who's had a tetanus shot recently.
Mhm.
That's the one that I remember causing the most arm pain,
Mm.
and then just kind of general aches and pains. But you also don't have to worry. If you don't have a reaction to the vaccine, it doesn't mean your immune system is not working. Everybody's a little bit different. Some people have a bigger reaction than others, and that doesn't correlate with how well protected you are. All right, let's go to another one. So now we're going to get into grandchildren. So my
Mm.
grandchild's pediatrician is not offering the COVID-19 booster shots, and we're having trouble finding a provider. Why is it some providers are not offering the booster shots right now?
Well, I'll speak off the cuff. I would imagine that they're having difficulty just getting the vaccinations and the immunizations, and they are distributed to certain organizations and agencies that are dispensing them. They want to ensure that they're kept at the proper temperature and they're effective when they are administered. So there could be a chance that they're just not being able to acquire them. But at CVS, Walgreens, Walmart, these are all places that you can get them administered to you.
And just, I'm not sure how old your grandchild is, but if they're under 5, you say you want to take them to CVS, you actually have to make an appointment at the Minute Clinic, and they'll, give the COVID vaccine and the booster.
Excellent, excellent. And you can probably get your flu shot at the same time.
Mhm.
For children as well, that's important, because we know that children are actually the some of the best transmitters of influenza, because it's the first time they've gotten it. They shed higher virus, and they're very happy to share their secretions. So their snot, their runny nose, they're happy to share that with you. Maybe they won't share their toys, but they don't mind at all sharing that nasal stuff with you. And we of course always like to be close and personal and hug those little children, and that's a way that they get right in your face, and they may transmit more than just love.
Mm.
So just keep that in mind and make sure you get them immunized so that they're not bringing anything home to their grandparents or parents or siblings. Here's another question. I'm a woman in my 60s and have other chronic medical conditions, high blood pressure, diabetes among them, and they're managed by prescribed medicines. Do I need to be concerned with which booster I receive? Does it matter whether I get Moderna or Pfizer?
No, honestly, on that one. So no, and I think that continue taking the blood pressure and diabetic medications, and you really should get the booster because you are more susceptible because of the comorbidities that you have.
Okay. Now this is a question about J&J. So I was vaccinated with J&J Janssen vaccine and the J&J booster last year. Should I be seeking additional boosters, and what are my options now? So this person has gotten 2 J&Js.
I think the right answer to that is you're going to move forward with the Pfizer or the Moderna. And Johnson & Johnson does not have a bivalent booster available right now.
Absolutely.
And the CDC website will confirm that as well.
Yep, no, yep, absolutely right. And yes, you do want to get that because we do know that the protection with the messenger RNA vaccines is a little bit better than with the J&J. So here's a question. Physician mentioned I should wait to get my COVID-19 booster until several weeks after I get my annual mammogram because of the potential swelling of lymph nodes showing on my results from the booster. Am I facing any risk waiting to get boosted?
That's a loaded question. Well, I think you are, facing risk not getting your booster. And again, we're going into the season to bring it up again. So really getting that on board sooner rather than later will be important. I wonder if I'll scratch my head a little bit. Was there some abnormalities on the mammogram before this that might be complicating it? And I would ask them about that, but I would proceed with with that. My guess is that you probably would have lymphatic enlargement, not around the breast so much, but maybe in other parts of your body with that.
So that has been noticed, and it's the lymph nodes usually in the same arm, and it can be the axillary lymph nodes, which can show up on a mammogram, and it can be confusing, and look as though you're having disease that has gone to your lymph nodes. And I agree with you 100%. It depends why you need that mammogram right now. If it's an annual mammogram and you haven't had problems, what I would say is get boosted first, wait a few weeks, and then get your mammogram, rather than the other way around, because now we really are seeing an uptick in the amount of COVID-19. However, if you need to get that mammogram because you had something abnormal and it's, you're getting a follow-up mammogram, that's a different scenario. Then you may just want to go ahead and get that mammogram and see what it shows. And then the very next day you can get your booster.
Mm-hmm.
So interesting question. We have a question from Melanie. My mother developed symptoms the same day she received the booster and ended up testing positive a few days later. Do you think the booster brought it on?
I've heard that so many times, and scientifically it can't happen. And just because of the way that the vaccines are made, it's just not an active virus. But that's not the first time I've heard that, and it probably won't be the last time. I would highly suspect that she had been exposed to that, and it was just a coincidence that she tested positive.
Yeah, we hear the same thing with the flu shot. How many times have you heard people say, "Oh, I get the flu from the flu shot"? You can't get the flu from the flu shot, but you can get kind of achy, symptoms that are related. But you wouldn't have a positive influenza test, just like with the COVID vaccine, you wouldn't have a positive nasal screen. So after you get the vaccine, you don't get a positive nasal test. It can't make your test become positive. There has to be virus there to make your test be positive. So I think this was just bad luck. Maybe you got exposed to COVID right at the time that you were getting your booster, and the incubation period is relatively short for COVID, so it just popped up pretty quickly. But it wasn't from the vaccine. But that a lot of people, it's a thing I think we've all heard 100 times.
Mm-hmm.
Here's a question from Alicia. If you are scheduled for a procedure and your next booster is due during that time, should you put it off till after your procedure, or should you get it before your procedure? What do you think?
I think it depends. What is the procedure? Yeah, would be one of the questions that I would ask. And I don't, depending on what it is, it probably wouldn't prevent you from moving forward with that procedure. And I'll tell you something, if they're testing you before going to surgical centers, and if you test positive, that'll delay the test. So you really want to be protected against the COVID, and the vaccines will help you to do that.
Yep, I'm with you. So I would say, in general, don't put it off, because you don't want to get COVID in the meantime. Yes, you want to be healthy for your procedure, but the COVID shot's going to make you ready to roll for most anything. And, wherever you go for your procedure, you're going into the public, you're running the risk that you'll come in contact. So protect yourself as much as you can. Do we have any other questions? So let's talk a little bit about influenza. What are you recommending to protect your patients against the flu?
Getting the flu shot, right? And if you're over the age of 65, you get the high dose immunization. That's more protective. It has 4 times the components in there. I will say, people really, it's out there. And it's undeniably people are coming into the hospital with influenza. So really get your flu shots. And if you're younger than 65, you just get the regular immunization, unless you have you're immunocompromised or have other complications.
Now, with all these viruses floating around, is there any way we can tell influenza from COVID, from RSV? What do you think, Rahi?
I feel like the symptoms overlap a lot in all three. You could have a cold and, you may have RSV, you may have COVID, same with fever. A lot of the symptoms overlap. So definitely best to do, what you can to stay safe and also protected by getting vaccinated for COVID and the flu.
Some of the others, there is the rapid flu that you can test for and the COVID antigen test. And I guess they would do a viral panel to find the RSV virus as well. So hopefully you don't have to do that, but people are really getting walloped, right? Particularly older people with the RSV this year that I've never seen that before. And they're getting really, really sick and staying at home because of that. Usually it's a more mild in adults, but not right now.
Let's talk a little bit about therapy. Which of these, what should let's say one of these people who called in, Sally. What if she gets COVID? If she tests positive, what should she do? She's 87 and she's healthy, but she may have some other complications. So what if she tests positive for COVID? What should she do?
Right. You want to take this one or?
Yeah, sure. So we have a lot of calls like this at the FQHC where a patient calls in, they have a rapid COVID positive test. Depending on, usually my younger patients who are not very symptomatic, they're not having shortness of breath, they may be having mild symptoms. I tell them to stay home, isolate, take Tylenol if needed. If they're having any trouble breathing, then definitely come to the emergency room. With my older patients, definitely if they have other comorbidities, they have diabetes, high blood pressure, I like to just have them go in and, get checked out just to make sure they're not having any desaturations or drop in their oxygen level. Their chest x-rays aren't looking too bad. The worst thing is that, they'll get checked out, everything will be fine. They may be sent home on Paxlovid. If not, they'll be admitted.
And who can't, or what are the complications from prescribing Paxlovid?
So
Medicines?
if you're taking a cholesterol medicine, like an atorvastatin or rosuvastatin or something, you should hold it while you're taking Paxlovid. And then also if you're on a blood thinner, like Eliquis, you shouldn't be taking a full, usually we either reduce it by 50% if you're on it, or we start you on something different if you're, in the hospital and could get something different.
Yeah, I think the other thing that's perfect advice. And the other thing I tell people is don't wait until you get real sick. We know that these medicines work best if you take them right away. So as soon as you test positive, and that's one of the reasons to test yourself if you have symptoms or if you've been exposed, as soon as you test positive, start the Paxlovid, but talk to your pharmacist and your doctor to see if you need to change the medicines, just like we heard. There are some medicines that react poorly with Paxlovid, but most people can take it. What if they can't take it? Are there any other options?
There is remdesivir, something that can be given intravenously. Usually that's done at the hospital, and there's some places around the state that are able to provide that.
Right. Yeah, some infusion centers, right.
A little bit of coordination with that, but that is an option as well. And the monoclonal antibodies that we heard so much about at the start of this year really aren't effective any longer, unfortunately. And that was a different way of treating it, that there were actual antibodies that would attack the virus and kind of artificially, right, if you will.
Yeah. But those antibodies, unfortunately, don't work against these Omicron variants.
They do not.
So now we have the pills or the IV medicine. And we do know that early treatment is the way to go. And people who are at risk for progression of the disease, you do want to get them treated. How about the flu? What if Alicia ends up getting the flu?
So if someone calls in with and they're positive for flu, we do recommend starting Tamiflu within 72 hours of symptoms to definitely reduce the symptoms of having the flu. And that's also safe in pregnancy. I just wanted to, let
Good point.
the viewers out there know I have a lot of patients who come in who are pregnant who have had the flu, and Tamiflu helps them. And then there's patients who are very scared to take the COVID or flu vaccine when they're pregnant, and just, it is recommended.
Excellent. Well, we've had a few questions come in here. So one of the questions is, with all the news of false negative tests, how do you know if you really have COVID and not a common cold?
I think I have heard people testing negative in the morning and having upper respiratory symptoms, and then testing negative by noon. I think retesting, and I think being very suspicious of whether or not this is COVID. I think you're going to treat yourself kind of the same. You're going to isolate. You're going to make sure that you're drinking plenty of fluids and resting, and then retesting if that's the case. The antigen is pretty sensitive though for picking up the COVID, and there's also a PCR, which is a different test that actually looks at the virus that might be in your sinuses. And I think the next question talks about the false positives, and with the PCR, you can remain positive for a long period until the debris from the virus is cleared from your nasopharynx.
Right, and a long time is weeks to months. So it's actually recommended that you not get another PCR test for 3 months after a positive, unless you have symptoms or some other reason that you would be tested. But it's not reliable because it can stay positive. And that the antigen test, is a better test of whether or not you're contagious. So it's a good one to use when you're going for those when you're visiting family and you're going to those indoor gatherings. Now, one of the things that can make the test falsely negative is that you didn't do the test right. So an important thing for the home test, look at the expiration date, make sure that the test hasn't expired, because after a while, the reagents do stop working. So you want to make sure that the expiration date is okay. And then you need to collect the sample appropriately. So you're not swabbing the top of your lip. You really are getting it in your nose. It doesn't have to go up to your brain, nowhere close, but you have to get it in partway, up to about here in your nose, and then swab it around briskly 4 or 5 times. It should be a little bit uncomfortable. It shouldn't be horrible, but it should be a little uncomfortable. And then you're going to do the same thing on the other side so that you actually get a good sample. If you just sample that, your upper lip, you're going to get a false negative all the time. So it is important how you do the test, and it's also important to make sure the test hasn't been outdated. But just as Josh said, the PCR test is much more sensitive than the antigen tests. So if you have prolonged symptoms, your doctor may ask you to go to an urgent care center or a hospital where you can actually get the PCR test if there's a question. And why is it so important to know? And really, that's just because if you have COVID, you're going to get Paxlovid. If you have the flu, we're going to want you to get oseltamivir, and Paxlovid doesn't work against the flu, and oseltamivir doesn't work against COVID-19. So, and unfortunately, we don't really have anything, any antiviral at this time in 2022. We don't have an antiviral for respiratory syncytial virus, but they're working on both a vaccine and a monoclonal antibody for RSV, which I think we may have as early as next year, and that would be really very helpful. this RSV has really shown us what a serious and significant disease it can be in kind of overwhelming our hospitals. Let me go. We have a couple more here from Roxanne. Is the state also encouraging people to educate themselves on therapeutics for COVID-19? And I'm from the state, so I'll answer that one. Absolutely. We want you to be educated about all things. And I think my colleagues would agree with me. An educated patient is a better patient for us. We want you to have all the information, but we want to ensure that you get that information from reliable sites. Googling things, you will get all kinds of information, some of it good, some of it misinformation, some of it disinformation, which is meant to mislead you. So make sure you're going to accurate sites on the web. The Centers for Disease Control and Prevention is an accurate site. The New Jersey Department of Health has a lot of wonderful resources. The Family Medicine, the American Association of Family Physicians has a great website that's got lots of information, and there's a New Jersey chapter that has good information on COVID. And then talk to your doctor. Use your healthcare provider, your physician, your nurse practitioner, whoever you're seeing. Ask them for information. Don't just take it off of the web, because there is a lot of misinformation out there. Let's see. Here's another one. Will the vaccine or booster help me avoid long COVID? What do we know about the vaccines and long COVID?
I think the long COVID is more of an individual and their reaction to getting COVID. So if you don't get COVID because you have a vaccine, you won't get long COVID. So I think that's the answer to that. Good.
Yeah.
But it really, some people are devastated, and really a prolonged recovery from that, with brain fog and many other fatigues that's associated.
Yeah, it's a horrible problem. And we don't know for sure. There have been some anecdotal reports that some people with long COVID who get vaccinated have their symptoms lessen, but that's not uniform across the board. So there's no reason not to get vaccinated, even if you have long COVID. But there's also, we can't tell you for sure that it's going to be helpful for you. There is also a little information that if you get COVID more than once, you are a little bit more likely to get long COVID. So again, keeping up to date with those boosters is good advice for that. Then here, someone wants to know, how do I know if I have long COVID, and is it something I need to be diagnosed with?
There are people who have had COVID and are hospitalized and go back home and they just aren't getting strong again. I'd go back to your doctor and have them have a discussion. There are some offices, and I'll call them clinics, but they're the long COVID clinics, and Robert Wood Johnson has one. We have one up at Centra State. And it really focuses on the recovery from that, making sure that you're participating in pulmonary rehab or cardiac rehab if you needed that, and getting your strength back.
Absolutely. And there are lots and lots of symptoms that can go with long COVID. We mentioned the brain fog, but there's also, you can have heart palpitations, you can have pain anywhere and everywhere, from headache to joint pain to muscle pains to abdominal pain, sleep problems, mood problems. It's very, very non-specific. And then it can be just fatigue. But this is fatigue that gets even worse when you do even minimal kinds of things. Also, the cough can go on for a long time. The shortness of breath can go on for a long time. So there are lots and lots of things that go with long COVID. But those symptoms of long COVID also go along with just living in 2022. So, fatigue is often part of our life. I don't know a whole lot of, I think there was a study years ago that showed that 2/3 of people who visit their primary care doctor have fatigue. What do you find in your practices?
Right?
Yes, I definitely do have a lot of people come in with chief complaint of feeling, more tired. And then obviously we do, a workup, make sure nothing underlying is going on, but definitely is a common complaint.
Thanks. So this is a question from Penny. What about people who won't stay in quarantine if they test positive? We're dealing with this issue where I live. So this is just a note on semantics, and it's definitely semantics. So quarantine is for people who don't have the disease but have been exposed. Isolation is for people who have the disease. So what the reason I make the point is if you read the CDC website, or if you read about quarantine in the CDC, what the CDC now says is it's not necessary for people to quarantine. That's true. However, it is absolutely necessary for people who are infected to stay isolated. Now, I don't know what you do with someone who won't follow the rules. What would you do if you were in an assisted living system or something like that? And any thoughts on that?
You source containment, ask the person to wear a mask. And there's times where people might have memory problems that prevents them from remembering to wear that mask. I think that speaks to the importance of us wearing a mask, right? To protect ourselves. So when we're in movie theaters or at the airport or at the mall or at the supermarket, you don't know that person standing next to you at the produce counter. Could that be one of those rebels, right? That's out there that should be on isolation, that isn't. And for that reason, not a big ask, right? And when you're in the stores or around people.
Yeah, and the CDC has made it easier. They've decreased the isolation time to 5 days, but you need to wear a mask for at least 10 days. And an important item there, if you've had COVID and you feel well after 5 days and you're ready to come out of isolation, that's fine, but you still have to wear that mask, and you have to wear it all the time when you are with people. So you can't sit down to lunch with someone and take off your mask to eat lunch if you've had COVID within the last 10 days. So be sure people understand that. And it's a great point about memory problems and just forgetting or just not thinking about it. So remind them and help people to remember that they may shed that virus for 10 days. So that's why it's important for them to continue to wear the mask even after they come out of the strict isolation. And then there, for people who are on immunosuppressive therapy, like people who have transplants or people who are on a lot of steroids for any kind of autoimmune disease, they may be shedding the virus for a little bit longer. So those are the people that maybe should do those home tests before they stop their isolation, just to be safe so that they aren't exposing other people. Sadie has a question. Do we expect this to ever end, or will this be added to the other list of diseases?
This is an opinion, right? I think I think it'll get better, but I don't know if it'll ever totally go away. I think people that'll go on airplanes, I think people that'll go on cruise ships. I think this is something that will be in our around us for a while.
Yeah, I think Rahi, what do you think?
Yeah, I definitely agree. It was definitely bad when initially it came out, but we could see that COVID is still around, but people are getting less sick. And I, do think it's because of the vaccines. So I think it will be around, but it may be like, getting a common cold or getting the flu or, just mild symptoms.
I suspect you're both right. And if we kind of look at history, There are a number of different coronaviruses that we know have been around for decades, 50, 60, 70 years, that children cause common colds in children and can cause common colds in adults, the other coronaviruses. But then there was SARS-1, the original outbreak, and it caused a lot of disease in Asia, and then it just went away. It just went away for good. I was kind of hoping that SARS-CoV-2 was going to do that, but 3 years in, I don't think so. I'm with you. I think it's likely this is going to be around. In general, the variants, although they may be more contagious, they are not necessarily more severe. So in fact, we have seen that the severity of illness has gotten a little bit less with some of the newer variants. And what I would hope is that as new variants evolve that more people can get, it's not in the virus's best interest to kill off all its hosts. So if we think about it that way, the virus will probably end up living with us, or we'll live with it. But it's still going to likely be a problem for people who have underlying medical conditions and for older folks. And I think with that brings us to the end of the questions. Why don't we summarize a little bit? I would like to give both of our panelists a chance to really talk to you about, again, what their advice to you for the new year is. What kind of things should we be thinking about in the new year? What would your advice be if someone's trying to make some New Year's resolutions?
I'll go first. Back to basics. Let's get the booster and encourage people to do that. It really is. It prevents severe disease, and that's what we're trying to do. Also, wash your hands, wear a mask, test yourself before you go to family functions and large gatherings.
Yes, I agree. Definitely get vaccinated. If you have not gotten any vaccines, please get vaccinated. If you have gotten it, get boosted. Wear your masks, wash your hands. If you are feeling sick, don't expose others and stay at home.
I like your advice a lot. And I guess the other thing that I would add is, we've all been in addition to being physically distanced, many of us have had to be socially distant. And that's not a good thing for most human beings. So really try to keep your connections, do it safely. Don't socially isolate yourself or socially distance yourself. Physically distance yourself when it's appropriate, but keep those social contacts. Find a way that you can stay in touch with other people and take care of your anxieties, your well-being, and I think interacting with others and if you have younger relatives and especially children, I'm a pediatrician, so nothing makes me happier than to see a bunch of children and maybe I don't want to interact with them as closely, particularly if they have the flu. But even just seeing them playing and being happy is one way it enriches my life. We did have one more question come in. So let me take this one. Laura asks, what's the average time it takes for most healthy adults to recover from Omicron if symptoms are no more than a head cold? If your symptoms haven't worsened by day 6, does that mean the recovery will be faster? So what's your experience been?
Golly, if you really have mild symptoms at day 6, it probably will go away quickly, and you would antigen test yourself to make sure that you're no longer infective. And I would imagine you would recover pretty quickly.
Yep, I agree. There's always going to be exceptions to the rule, but for the most part, by day 6 or 7, if you're doing well, it's very likely you're going to continue to do well. Yep. Okay. Any other parting thoughts for our audience? If not, let me thank all of you who've been with us tonight, and let me thank my panelists because I think they know a lot about aging well, and I'm happy to hear that because that's exactly what I'm trying to do as we go into the new year. So thanks, everyone, and have a great holiday season. Take care.
Happy holidays, everybody.
Yes, happy
Bye-bye.
holidays. Thank you, Dr.
Take
Fisher
care.
and
Thanks.
Dr. Raymond.
Thanks. Bye-bye.
Bye-bye.